The consequences of the Supreme Court overturning Roe v. Wade and allowing states to ban abortion are broad and sometimes unexpected. For instance, several people have said their pharmacist refused to fill their prescription because the prescribed drug could in theory be used for a medication abortion. But is that even legal? Can pharmacists refuse to fill a prescription issued by a doctor? Let's verify. Our sources: Anna Legra-Dopp, the Senior Director of Clinical Guidelines for the American Society of Health System Pharmacists; Donald Miller, a professor of pharmacy practice at North Dakota State University; and various state laws governing pharmacy practice. The simple answer is yes, pharmacists have discretion to fill or not fill prescriptions. There are any number of reasons why they might choose not to. It might be a suspicious prescription for opioids. It might be because the new prescription could interact negatively with other drugs the patient is taking, or the pharmacist might suspect an error in the prescription.
Pharmacists are not machines. They always use judgment in dispensing.
In fact, state laws often explicitly state that pharmacists have a duty to use that professional judgment. In some states, they can refuse to fill a prescription purely because they have a personal objection to the drug. Many states and pharmacies require that in those situations, the pharmacist refers the patient to another provider or hands them off to a colleague, but not all. So we can verify, yes, pharmacists can refuse to fill a prescription issued by a doctor. Now, what we're seeing right now isn't necessarily a personal objection on the part of pharmacists. It's a fear of possible legal consequences for providing the drug. For instance, methotrexate is commonly used to treat a number of conditions, like rheumatoid arthritis, but in higher doses is sometimes used to treat ectopic pregnancy. That means in some states it is classified as an abortion medication, potentially exposing pharmacists who provide it to legal repercussions.
We don't know what the ramification will be experienced now as a clinician tries to make these decisions, or if they might be prosecuted 10 years from now.
So how can you avoid hitting these roadblocks if you need a drug considered to be an abortion medication? Experts say the best ways are to have your doctor write the reason for the prescription on their note to the pharmacy, and to build a relationship with your pharmacist so they already know who you are and what you're using the drug for.
As long as there is a reasonable expectation that the prescription is legitimate, you should be fine.
With your Verify, I'm Casey Decker.